Hi, everybody. Welcome. We're so glad to have you joining us today for our webinar on complex care programs. I'm really excited about the lineup that we've got and the people that we've brought in to share a little bit with you, both caregivers with their experiences and professionals working in this space. So if you don't know me, my name is Gabi Conacher. I am mom to a 10-year-old who has a developmental and epileptic encephalopathy. And I'm the co-founder of Deep Connections, which really was started with the desire to see more families who have kids that are medically complex and have epilepsy get access to resources to help them advocate for better care for their children and feel more empowered to do the day-to-day that it takes to really keep our kids going. So most of this is going to be easy. I'm just going to quickly share that everybody who is not a presenter is on mute and off camera, so you can be multitasking and doing whatever you need to do and you won't be seen or heard. Please feel free throughout to use the chat and the Q&A to drop questions or thoughts if you just something resonates with you or you want to share a thought or have a question. Please do go ahead and drop those in, and we will have plenty of time at the end for some discussion and Q&A. So with that, I'm going to start by introducing the panel that we have with us today, who you see on the screen. I'm going to introduce our first set of speakers who are going to talk about their work at Cincinnati Children's, and then we'll pause and I'll introduce our second round of speakers who are at Vanderbilt. So to begin with, so Amelia Auberger is a licensed social worker who got her undergraduate degree in elementary education at Ball State University and her master's in social work at the University of Cincinnati. She's worked in a wide range of settings and throughout her career and has including direct care, casework with Child Protective Services, management at the Ohio Board of Developmental Disabilities, and as a director of mental health services. She enjoys all areas with the wide scope of social work, but shows special interest in children with developmental disabilities and medical complexity, as well as understanding and supporting families in healing from the trauma associated with many diagnoses, as I think a lot of us can relate to that. She has a certificate of trauma responsive care and holds an independent license in social work. So she lives in Cincinnati, Ohio, with her husband of 14 years and her daughter, Addie, who has been a medically complex child since her birth. From the same institution at Cincinnati Children's, we have Scott Callahan, who is an assistant professor in the Division of General and Community Pediatrics and is the current medical director of the Complex Care Center at Cincinnati Children's Hospital. After completing 4 years as enlisted as a search and rescue swimmer in the United States Marine Corps, I love hearing these cool background about all of you guys. Dr. Callahan spent 14 years in primary pediatric care in a rural primary care setting. We need a lot of those people. Thank you for doing that. 6 years of that were spent as medical director and participant in the NCQA PCMH process. So exposure to population health and value-based care, risk-based stratification, all of these kinds of things has really helped shape him. And he became the director of the Patient-Centered Learning Collaborative at CCHMC, which successfully moved more than 14 community primary care offices into medical home practices. After experiencing the limitations and challenges related to identifying resources and coordinating care for the technology-dependent children, he made a transition to an academic position in a tertiary care facility to focus on improving the care, management, and sustainability of the overall healthcare for children with medical complexity. And we're glad you did. Thank you so much. Lastly, from our team at Cincinnati Children's is Abby Musial. She's a pediatric hospital medicine fellowship trained pediatrician. She spends about half of her clinical time as a hospitalist, and I love hospitalists, so yay, and half in the complex care clinic. She serves as the medical director of the inpatient complex care team at Cincinnati Children's Hospital. Abby holds a master's degree in clinical and translational research and has completed advanced improvement science and leadership training through the Quality Scholars Program. Her passion and career goal is to improve the quality of life and health of children with medical complexity, with a focus on reducing the burden of care delivery and coordination of care on caregivers. So with that, I'm super excited to get us started. I'm going to pull up the slides, and those of us who are not going to be speaking are going to disappear for a minute until it's our turn. And let's see. Okay, here we go. Technology is giving me challenges today. There we go. All right. All right, Amelia, the floor is yours.
Thanks for that nice introduction, Gabi. In case it looks like I'm moving around here, I'm petting my dog to keep her quiet. So just thought I'd give you that heads up. So to start this thing off here, I wanted to just share my personal story with my daughter, Addie. She is 14 years old today. She was born at 23 weeks gestation and weighed in at a whopping 1 pound, 7 ounces and was 11 inches long. I love that picture of Addie, my husband, holding Addie in her incubator, because I think it just really gives perspective of just how tiny and premature she was, just seeing her in his hands like that. So this was the very beginning of our journey with medical complexity, something that my husband and I never, ever planned for. And it just hits you when it hits you, and you just have to take it in stride. And it's been a very scary, but beautiful journey along the way. She, well, all of us actually spent 119 days in a local NICU here in Cincinnati. It was not at Cincinnati Children's Hospital. And lots of amazing things have happened in our journey here. Next slide, Gabi. So just to give you just a little bit more just perspective of what we were dealing with when Addie was discharged. I'm sure many watching this probably have very similar stories. Addie was discharged on oxygen. Shortly after she came home, she was hospitalized for failure to thrive. She just had a very difficult time sustaining her own nutrition because just the difficulty and just being able to get that suck swallow coordination. So she was failure to thrive and was hospitalized for that. After me fighting and refusing for a couple months, I finally agreed to a G tube. It just took me a while to just really admit that my daughter was not going to be able to do this and would need a G tube. She had an NG tube for several weeks, a couple months actually, until we could just see that it just became clear that she was going to need the G tube. It was going to be something long-term, and it was actually the best decision that we made for her. When she also came out of the hospital, she was initially followed by a local pediatrician, not complex care, but just a community pediatrician who was also absolutely fantastic and did the best job she possibly could with her. She was seen by 9 different specialists, and then she had occupational therapy, physical therapy, and speech therapy, each 1 time a week. So we averaged about 16 appointments monthly for about her first 3 years of life. Many parents take their kids to soccer and dance and ballet and gymnastics and that sort of thing. And my husband and I used to laugh that we took ours to the doctor and to therapy. That was our life. So currently today, Addie, she is non-ambulatory. She uses a wheelchair. She's nonverbal, but she's a sassy little thing. She uses a communication device to speak with us. And she does a very, very good job with that. And we're really glad that she does have that ability. Next slide. So just a little bit about my complex care journey. I've got kind of a dual relationship here. I'm a parent of a child who receives services in complex care, but I'm also one of the social work care managers in complex care at Cincinnati Children's. I started my job there about 5 years ago. And to be honest, when I came into complex care, I mean, I just knew that I had a passion and a love and experience with kids with disabilities. But when I took on my role there as a social worker, I wasn't real super clear exactly what I would be doing until I got into the trenches of it. And the more I became familiar, and learned my job and the environment, I just started saying to myself, why doesn't my daughter come here? How come I did not know about complex care? Looking back on it now, I think if Addie would have been in the NICU at Cincinnati Children's Hospital, it would have been something that we would have known about. But she was in a local NICU that also did a fabulous job with her. And she ended up, like I said, with a really, really good pediatrician. I just didn't know that I was missing more benefits with her that I would have become familiar with earlier, had we gone to complex care earlier. So a couple years ago, Addie just started having a new issue that was requiring a lot of coordination with her GI doctor and just other specialists involved. And I was just starting to get a little frustrated because her pediatrician is not part of Cincinnati Children's network. And I just wasn't able to get her on board in this planning the way I could see it working in the clinic that our pediatricians were doing in those situations. So I had a conversation with her pediatrician, and both of us together just decided that Addie probably would be better served in complex care, and she did make the referral. So had a lot of onboarding discussions. It is kind of a conflict of interest. You have things you have to consider when you know that, where you work is also a place where people are going to have access to all of your very private medical information. So all of that was explained to me. And at the end of all of that, Dr. Callahan and I decided that Addie would be a good fit, and it was okay to onboard her in complex care. So she's been a patient in complex care for just about the past 2 years. So next slide, please. So some of the benefits of being in complex care, some I'm going to speak of our experience with Addie being there. Others are just my experience with other patients and having worked there for the past 5 years. In our complex care clinic, all of our providers, their expertise with very rare conditions and disorders is just absolutely phenomenal. There's just, and I get that feedback from my parents that I work with at the clinic, just the comfort and how they just feel very safe just knowing that their doctor just really knows and cares about their child and is able to take things to the next level and make really good referrals and recommendations. The confidence that they have with equipment, I mean, that's just something that we didn't even have with Addie. Addie just had a G-tube and was on oxygen, but that's not something that her pediatrician ever really, her outside pediatrician ever really had just really much to say about that. Everything was just kind of referred to a specialist for that. It worked out okay, but it would have been nice for her pediatrician just to be able to give us just a little bit more input and just a little bit confidence in that area. And that's something that I see is a big benefit of being in complex care. All of our kids that come in, they come with wagonfuls of, they might be in a stroller and then a parent's pulling a wagon behind them with their oxygen and their suction machine and their pulse ox and their ventilators and just everything that they need just to be safe during that appointment. Another benefit of complex care is just knowing when to make referrals, just looking at the patient and saying, gosh, they're at that age, they're going to be starting to maybe try to bear some weight with a stander. We probably need to look at, do they need some ankle foot orthotics? Do they need a stander? Just a variety of different things that come up just based on the ages of these kiddos and what they're doing at the time. So those referrals and just the professionals in the complex care clinic knowing when to make those is really, really enlightening, because we as the parents don't know when it's time for something. We kind of wait for the professionals to tell us those things. One of my favorite things is the collaboration with the care team. Just the fact that Addie's now in complex care and her pediatrician is in there and in the same network with all of her specialists. I can go to that pediatrician. It might be something that I heard from another parent that I wonder if it's going to be appropriate for Addie. And just being able to go to that pediatrician and the pediatrician being able to collaborate, send epic messages, talk to the rest of the members of the care team and get that input and get back with me has just been been golden. I mean, when this started happening 2 years ago, I thought, oh my gosh, I loved her pediatrician for the first 2 years, but I didn't really know that I was missing out on that collaboration that has been so important. Collaboration with the schools and other outside resources. As you know, anybody who does have a child with medical complexity, there's always exceptions and notes and orders that you need from the doctor to be sent to school so our children can be safe there and have meaningful days. That is something that just so easily and readily comes from this clinic. And the access to the multidisciplinary team is phenomenal as well. I know Abby and Scott are going to talk about, the dynamics and what's involved in the complex care clinic, but just mentioning here, just like the registered dietitian and the pharmacist, those have just been really big resources for Addie, just to kind of have at my fingertips, to be able to send a MyChart message to and get answers. If insurance isn't going to cover a certain medication, or they need a prior auth for something that just seems really silly, our pharmacist can just step in there and just make it happen. She completely takes the drama off of me as the parent, and she's been able to work this stuff out quickly and get Addie's medication, which we all know can be pretty difficult. So next slide, please. Just benefits continued, or just like I said, the quick turnaround with questions. It just means so much as a parent. You just have to deal with so much red tape and so much of the system, and you have to fill out things that you don't want to fill out, that you're going to get denied for, just to get the waiver or whatever resources that you have in your community. And you just get really bogged down spending a lot of time on things that just aren't going to get you anywhere. So the quick turnaround that we give our patients, and that I get from my daughter's medical team, is really, really, it's just been a blessing in our lives. Community referrals is something that has been different in complex care compared to her community pediatrician, as well as the encouragement for extracurricular activities. A lot of people just a lot of professionals just don't really understand how important it is to make sure that we are referring these kids out to be involved in Miracle League and adapted dance classes and gymnastics classes, just things outside in the community. These kids' lives just become these appointments and these therapies that sometimes we have to take a step back and make sure that we are including social lives and community interaction into their daily agendas. And that's something that I really love that complex care gives to patients, and that they've given to me, because just because I'm a social worker and I refer all of my patients to do these things, I don't always follow my own rules or see the need to do it. There's been several times when, even in just the past couple of years, that the complex care team is just kind of like, okay, wait a second, Amy, let's take a minute. Why aren't you doing this? Have you thought about that? And it's just been just very beneficial to my husband as well, because we go to all appointments together. So we both hear the same thing. And he's just made many comments like, gosh, they do such a good job explaining things to me and helping me understand what the needs are and why we're doing things. Another benefit is the ability to bring specialists into our appointments. If I have an appointment with complex care, and these aren't just like 15-20 minute appointments, you're talking about scheduling an hour, and because there's so much to cover and they prepare for that. There are also times when we might have pulmonary down the hall. We have a child who's in clinic who is having difficulty with their pulse ox machine, and they don't feel safe. We don't feel safe having them leave with the pulse ox machine not working well. So we can call pulmonary, and maybe pulmonary can come join the visit and help offset some of that stuff. So it's just an environment that's very inclusive and brings other professionals into it as needed. We kind of like just make up the rule that day for what's needed for the patient, and that's really how it should be.
Amelia, one more minute.
Okay, almost done. So the Title Care and the telehealth appointments, I know that Scott and Abby are probably going to talk about those more a little bit in their presentations, but that's just been a huge benefit, because it's very difficult to, bring your child and the wagon full of equipment to appointments every day. So it's nice to be able to collaborate by Title Care and telehealth to possibly be able to miss that, make it a little bit simpler for the parent. And then lastly, I just wanted to touch on the support with transition. There's just some milestones with our kiddos that parents don't always think of. Like at 2.5, we start talking to our parents about preschool that they're going to be eligible for at age 3, and the looks on the parents' faces, oh my gosh, I can't believe we're talking about preschool for this medically complex child. But the more we talk about it, and kind of like I like to say, have their brain marinate in it, they get to the point where they see it is a benefit and something that that is good to start to think about. So I think that's my last slide, Gabby. Yeah, so thank you for listening to me and letting me speak today.
Thank you. That was fantastic.
Yeah, so thanks again for the invitation. My name's Scott Callahan, and it was a really bad idea to follow Amy Allberger, but I'll do my best. And clearly, whatever very manageable conflicts that there might be between having Amy and her child in the clinic are outweighed by the benefits of having a parent caregiver employed in the clinic who brings Amy's perspective to the clinic and to the patients who seek care there. So we can't be thankful enough for having Amy employed in the clinic. So I think some of the conversation is going to switch just a little bit to the different modalities of complex care centers, and just to give a little description of the Cincinnati Children's Complex Care Center. It functions primarily as the primary care medical home, meaning we do the annual well child visits, the healthcare maintenance visits. We also are here and performing acute visits for acute issues that come up. We have same-day appointments available, just like a regular primary care clinic does. We are, however, embedded inside the hospital itself, so we are not integrated into the general pediatrics primary care clinic, because it's really nice to be in the building where you have access to the Pyxis machines and the other durable medical equipment, and the locations where a lot of the other specialists are practicing their outpatient clinics. So we also have access for those times when it can't be avoided to the full emergency room department. And we have 2 locations, one here at our base, one at another site that's just north of here that's also inpatient, outpatient, with a full service emergency room at that location. We do provide a few. We are working on being better at finding a way to provide some of this care to patients who live beyond our service area, which is a 60-mile radius from Cincinnati Children's. But we haven't quite mastered that yet, and we aren't yet ready to roll it out to everyone. But I believe that we've now serviced 30 patients in 4 states. So hopefully we'll get a little bit better at that technique. Next slide, Gabi. So people always ask, like, and people inside the institution frequently ask, will this patient qualify for being in your clinic? And we do have a fairly standardized admission process where an order is placed in Epic or faxed to us with a very specific template of what are you looking to accomplish if you transition your child to complex care, and what are the current medical complexities, where we go through and look for things like technologies, trachs and G tubes, VP shunts, backup and pumps, as in addition to and as well as a host of other subspecialists that might be involved in their care. And next slide, please. And so when we do accept these patients with these standardized criteria, we end up having a population that sees on average 8 subspecialists for each one of these patients. They usually have average about 4 visits in complex care each year. Obviously, the young ones who are just coming in, just graduating from the NICU or just newly diagnosed tend to have much higher frequency of visits. And as those parents and caregivers get older and get better at management, you find that the frequency of their visits tends to decrease. Let's see here. But on average, the patients have about 2 admissions per year. Each one of those admissions is about 9 bed days, which is much longer than the average admission for non-medically complex children. And it's an important population for lots of reasons, mostly because these children deserve all the support that they can get, but also that they have a lot of utilizations, which brings a lot of focus to them. And 1/3 of all the child health expenditures in the US are related to this population, as well as 1/4 of all hospital days. And Amy talked a little bit about everything that goes along with being a parent of a child with medical complexity. And here we talk about the 28 forms per year on average. That's usually feeding orders for schools, DME forms, referrals for PT, OT, and speech. So in average, we end up producing about 13,000 pieces of documentation for about 625, 630 patients per year. Next slide. So, like I said, our clinic is in a tertiary academic medical center. And so our provider panel kind of reflects that a little bit. We've got my FTE is the medical director. We have 2 nurse practitioners. We have some physicians who are on faculty tracks and some who are clinical physicians or staff physicians. In total, though, we currently have about 5.4, soon to be about 6.2 total FTEs of providers in the clinic. And more importantly than the providers, I would probably say, is the support staff who the institution has allowed us to kind of place in complex care to facilitate and help out the patients and what they need, which is 8. So we have 5 RN clinical managers. We have the clinical RNs. I'm sorry. We have our 1 clinical manager who is responsible for the 6 clinical RNs. We've got 1 medical assistant. We've got RN triage, which is basically the phone calls that come in during the day. Those phone calls are usually complicated enough that you need somebody with a RN licensure just to take those phone calls and to triage those things to the clinic or the emergency room. We have 1.5 FTEs of dietitians. The PharmD is embedded in our clinic, which has been a wonderful addition. We have 5 RN care managers, now 2 RN care coordinators, 3 social work care managers, and 1 social worker, which I think is quite unique and a pleasure to have. Next slide. And just for the previous year totals, total number of visits, and you can see that telehealth is an important thing if you've got a family who is challenged in transport, whether that means that they have barriers in not having their own transportation or just having the ability to get to school or get to the clinic is an issue. Telehealth really helps to make their lives better. And so we average somewhere between 16 and 20% of our total visits are by telehealth. And I think Amy mentioned TytoCare, which just briefly is an augmentative device that allows you to perform a more comprehensive evaluation physical exam by having a stethoscope, an otoscope, thermometer, tongue blade depressor that kind of extends your ability to perform evaluations via telehealth versus what's typically available with just somebody's cell phone. And I think that's it for me. I can hand it over to Dr. Musial.
Thanks, Scott. And I just want to thank Gabi again for letting us talk about our program at Cincinnati Children's. We're super passionate about it. So I work in the outpatient complex care center, but I also work on our inpatient complex care team, or yellow team, as we refer to it. Color doesn't mean anything. We're just a pediatric institution, so every team has a different color. It was founded 10 years ago. Complex care is housed under general pediatrics, and we're housed under the hospital medicine division. The team caps at 10 patients, just so we can provide a high level of care and attention to each of our individual patients, whereas our other hospitalists, general pediatrics teams do not cap, and their census can get quite large, up to 15, 20 patients. Admission criteria to our inpatient complex care team includes presence of medical technology, and if the child is hospitalized and needs coordination of care of multiple subspecialists. So for example, you may not necessarily be technology dependent, but you are here for, feeding intolerance and a GI bug. And as a result of that, you're not tolerating your seizure medications. And so your seizures are kind of out of control because that's kind of two different problems. They'll come to our service. We also prioritize patients who are in our hospice program, and then we prioritize patients who are seen in our complex care outpatient center. Next slide, Gabi. I think one of the things that makes Yellow Team really special is our staff. So we have a dedicated social worker who has been a part of the team since its inception. So she's been here for 10 years and was part of the creation of our inpatient complex care team. And so she has really wonderful relationships with many of the families that we see time and time again. We also have 2 care managers who are incredibly important, particularly if our families need to go home with nursing care or new equipment or have a new piece of medical technology after an admission. They're really great at kind of helping with all of that and getting things organized for the family, and just kind of taking the burden off of that care coordination off of the family so they can focus on getting their child well. We also have a dedicated dietitian. We have a pharmacist. We also have 10 advanced practice providers, the majority of whom have also been on our team since its inception. So again, they're always there, and they've been on the team for multiple years. And so they get to know our patients really, really well. And families will voice to me time and time again that it's a relief and really helpful to them that they don't have to, talk about their child's history and the story of their child, since they were in the NICU to age 10, they, are met with a familiar face during a stressful time, who knows their child really well, and, knows little things like we have to start really slow with feeds, or, they didn't, tolerate this, pulmonary toilet that we did before, and just has a lot of historical knowledge about the child and knows the family really well. We also have a small core group of hospitalists. So our total hospital medicine division, I think, is about 50 providers, and we have like 10 or 12, I think, hospitalists who do Yellow Team. So again, we get to know the families well, and just having more of a familiar face, I think, is helpful for everyone. We will occasionally have a hospital medicine fellow, and then we also have residents that rotate on the Yellow Team. Next slide. So some of the things that are a little bit unique about our team compared to the other hospital medicine services that I think are helpful to families is that we have scheduled rounds. So every day the senior resident will schedule which patients we're going to see when, which I think is beneficial for nursing to know in advance when rounds are going to be, and kind of organize their time to ensure that they are at the bedside and present and can advocate for the family and voice concerns and talk about things that might have happened overnight that the day team wasn't there for. And then I think it's also really helpful because it gives families a time frame for when the team is going to be by to see their child, so that they're not like, waiting from 8 to noon for 4 hours by the bedside, kind of wondering when the team is going to come by. We obviously prioritize by, acuity or family schedule too. So if, someone has to go to work, we can prioritize seeing that patient earlier to ensure that the family is there. Next slide. We also, part of the mission of our team is to kind of herd cats and coordinate with multiple subspecialists. So we routinely co-round with subspecialists. If there are 4 or 5 subspecialists involved in a patient's care for that hospitalization, we will try to organize rounds so that everyone or most of those subspecialists can be there, can hear, the presentation, and everyone can kind of collaborate and talk at the same time, so that we're not, like waiting on different recommendations from people, and we can just get the plan going for the day in real time. We also frequently organize care conferences, particularly for prolonged hospitalizations or hospitalizations where there, are a couple of different ways that we can go and options in terms of care pathways to take. And then we also will ensure that there's adequate follow-up with the subspecialists that were involved during a particular admission. Next slide, please. The other thing that we have that I think is helpful, in particular to children with medical complexity, is that every day after rounds, we have a huddle with the care manager, and we talk about discharge goals, and we outline, what needs to happen before discharge, and that is documented in the chart. So everyone knows what we're talking about. Everyone knows what needs to be done for the patient and the family, and they can be ready to go and get out of the hospital when their child is ready and the family is ready to take them home, and we're not waiting on, home care delivery and things like that. And we can just or a prior authorization, we can get the ball rolling. Next slide, please, Gabi. The other thing that we do that now has kind of expanded to all of our hospital medicine groups that I think is helpful is we do, depending on the schedule of the family, we'll do a pre-discharge huddle or a post-discharge huddle over telehealth. So this is really trying to address like that kind of transition from hospital to home, where the child may not be completely back to baseline, but they're ready to leave the hospital, just to make sure that everyone's on the same page. The family has all of their questions answered. The subspecialists have all of their questions answered. The general pediatrician is aware, or the primary care physician who's going to be a point of contact for the family is aware of everything that's happened in the hospital. It's a time for questions and concerns from everyone, from caregivers to the primary care physicians to hospitalists, wondering, what the ability of the primary care physician is to, get a lab or follow up on something is. And so I think this just really helps everyone who cares for the child, providers and caregivers, to be on the same page before or shortly after the child is discharged from the hospital. We also give a direct number to a hospitalist on call, who's on call 24 hours a day, in case the family or the primary care provider has a question about the hospitalization or develops an issue related to the hospitalization. We can help troubleshoot that. I think that's almost my last slide. I know that Dr. Freundlich is going to talk about the way the complex care center at Vanderbilt looks like, but this is how it looks at Cincinnati Children's. It looks a little bit different everywhere. If you are interested in finding a complex care center near you, if your child sees a subspecialist, often they're aware if there's a complex care center at your institution. I am also happy to help you find out if there is one near where you live. So you can email me, and I'd be happy to help you figure that out. I may not know the answer, but Scott and Amy know one of my top 3 talents is annoying people. So I can bug someone and find out if I don't know the answer. And then there is also a list that I think will be available on the Deep Connections website, or maybe Gabi can speak to where it will be available. That lists complex care programs by geographic location.
Terrific. Thank you guys so much. That was a really fantastic overview of the programs that Cincinnati Children's has. And I apologize, I don't know why the bottom bar says that. We'll fix it for the recording. It says Vanderbilt, but we'll fix it. And so thank you so much for sharing those experiences. Amelia, it was really powerful hearing you talk about a lot of the stuff that I think probably people listening in can relate to, and how powerful that really is for families to get that kind of support. And to Scott and Abby, thank you for what you do. That's really exciting about the kind of support you guys are able to provide. We're going to move now into the next part, where we're going to hear from the team at Vanderbilt and their complex care team. I'm going to introduce the team there. Christine Cahill is a parent caregiver to her daughter, Helen, who has Aicardi syndrome and experiences daily seizures, chronic respiratory disease, and profound disabilities. She is an active advocate, serving as a family advisor to the Monroe Carroll Jr. Children's Hospital at Vanderbilt, as well as the Complex Care Family Advisory Group. She enjoys connecting with parents of children with similar disabilities, and is currently the Parent-Teacher Association president at her daughter's school, which serves students with disabilities. That's fantastic. I'm going to quickly introduce Katie Freundlich as well, who is an assistant professor of clinical pediatrics at the Vanderbilt University School of Medicine, where she currently serves as the director of family, community, and referring network engagement for the program for children with medically complex needs. It's a mouthful, but a lot of really important words in there. She also serves as the Children and Youth with Special Healthcare Needs Network Director of Dissemination Core, to help the health service research results reach a broad audience of stakeholders. This CYSHC net is funded through cooperative agreement with the Maternal and Child Health Bureau. Dr. Freundlich received her medical doctorate from Baylor College of Medicine and completed pediatric residency and chief residency at the University of Michigan. She is also a board certified in pediatric hospital medicine. So thank you so much to you all for joining. I'm going to pull your slides up, Christine. Oops, why is it not going?
Okay. Hi, everybody. I'm not good with bullet points, so my slides are only pictures. I am Christine Cahill. My daughter, Helen, is pictured below. She just turned 7 in May. A little backstory about Helen. She was born in 2016, and she has been diagnosed with Aicardi syndrome, which is a neurologic disorder that causes brain malformations and difficult to control seizures. So Helen, at 3 months old, she started having seizures and had had some level of daily seizure activity since they started. The first year and a half or so of Helen's life primarily involved neurology, seizure control, developmental medicine, and kind of your basic therapeutic interventions like PT, OT. That it wasn't really until 2018 when we really got into the medical complexities. I remember it was January 1st of 2018, so New Year's Day at about 6 a.m. We ended up in the ER with aspiration pneumonia, and that was when she, we kind of referred to it as the collecting specialist phase of life. She has not eaten anything by mouth since then. She's been tube fed, and we were introduced to pulmonary, GI, surgery, ENT, multiple specialists in that visit, just to sort of tackle the current problem. But luckily, that was also the season we were introduced to the fantastic care team, complex care team at Vanderbilt. Dr. Katie came and met us that first inpatient stay and just truly helped us kind of process and understand what all of those consults meant and how it was going to play out in Helen's care, particularly in that spring and that season. They really helped facilitate and advocate for a combined surgical procedure. She needed an ear tube, she needed ear tubes, she needed a G tube, she needed bronchoscopy. And so they were able to coordinate that with all the different specialties, not only once, but multiple times, because we kept dealing with illnesses and reschedules. So that was a huge, immense help kind of initially. That was, the picture on the left is Helen when she was about a year and that was right after her G tube. So she was almost 2 years old there. And then the picture on the right is this past year. So we are frequent flyers in and out of the hospital, often for multiple different things. With each inpatient stay, we have a consult, or not a consult, we have care provided from complex care. They see us daily. And no matter what we're in for, they really help us kind of process, understand, and thoroughly discuss her status, how we think she's doing, and they know her history better than a lot of the other providers that we're seeing when inpatient. Make sure we have a plan and that we're all on the same page. It's kind of like a breath of fresh air when complex care comes in. It's just a nice time to really kind of debrief about everything that's going on. And so we're very thankful for all that they do in the inpatient stays. Next slide, Gabby. But outpatient is also important. I've attached a couple of outpatient pictures of Helen doing what she loves. And as far as complex care visits go, these are the most thorough visits we have. They were the first people to ever sit with us and go through everything with Helen. And we're just so thankful for that. The way they sit with us and they go through, first we start off and go through all of the DME, what we have, where it comes from, what we need, where we can get it, make sure all those orders are in place, things like that. We go through all of our medications, especially in the beginning when we started seeing complex care and we were transitioning from oral to G-tube medications. She was going from really having one or two providers to multiple specialists putting their hands in the pot. And she's on the ketogenic diet. So there's always that kind of outlying factor. There was a lot to go through, and the pharmacist with complex care went through everything slowly, made sure, verified, checked, double checked, triple checked. It was extremely helpful. And then they also discuss equipment, as Amy was saying. So, wheelchairs, standers, all of that, as well as equipment that doesn't always come to mind. They were the first, complex care in an outpatient visit was the first to ask us about a safety bed, anything like that, and a bath chair. And they were able to get us in contact with the people who could come to our house and evaluate what we needed, and then also filled out the immense amount of paperwork that is involved with any piece of equipment and getting it covered through insurance. So yeah, there's that aspect that they start every appointment with. And then after that, they just do a very thorough review of all of the systems, which you don't get usually in any sort of, it's just a very thorough visit. So we go through every system. This comprehensive overview is just vital for patients like Helen, and for parents like me to be able to thoughtfully discuss any needs and troubleshoot any questions, big questions, pressing questions, and some that are small and don't feel important but might play a role in the total care of these kids. And it's just a safe, caring, and truly understanding environment. Their intense, or their attention to detail is incredible, and their approach to care is holistic, considerate, and insightful. They have expertise in the medically complex child that's invaluable. And, we just feel lucky to be part of the team. They helped us get the swing in this picture. They helped keep a smile on Helen's face. They helped keep a smile on my face by doing all the paperwork to help with all this stuff. So, we're just, there's so many aspects I can't cover in a handful of minutes, but that's our story. And thanks for letting me share.
Thank you so much, Christine. And Helen is so beautiful. I love seeing those pictures. Thank you for sharing.
All right, I'm up. I'm Dr. Katie Freundlich. People call me Dr. Katie. I am the Director for Family, Community, and Referring Network Engagement for the Program for Children with Medically Complex Needs at Vanderbilt. And I'm really grateful to be able to talk to you today. We can kind of skip over my bio, I think, because Gabi did such a nice job introducing me. And I'm going to talk a little bit about our program. I think in many ways, I'm going to echo things that people have said already. But our program is kind of built on these 5 principles. Family-centered, and I mean family in just the broadest, most inclusive kind of way. We see families of all different shapes, sizes, descriptions, with the bottom line that they're caring for a child with medical complexity. And our goal is really to empower, educate, and share decision-making with families. So when we meet you, we hear your story and hear about your hopes and your worries and about your family in context. And then we have this ongoing conversation that helps us to use that as our guiding light and help make the best decisions together that we can. We function by continuity. So we have a small team that provides care across the inpatient, outpatient, and between visit settings. So our team provides consultation in the hospital, in our clinic, and then we provide a lot of ongoing between visit care by phone or by communication in the electronic portal. An example of how this helps is that some problems end up being recurrent problems. And it can have a feeling of a Groundhog's Day coming into an acute care setting and starting at square one. But the continuity voice can help inform acute care teams about what has worked and what hasn't worked, and what's been looked into and what hasn't been looked into yet. And so we can help shape and improve the care that's provided. Streamlined, I think that this is something that's really, really valuable. We do a lot to provide the good beneficial care and reduce the kind of bogged down care that can happen. So our scheduler helps to coordinate appointments. We often have our dietitian join in outpatient visits to help with nutrition questions. We may even decide based on families' values that it's okay to defer some visits and allow more time spent outside of the medical environment. We provide contingency plans for illness and advocacy for home needs like home health, equipment, medications that may reduce the need for emergency department or hospital care. And again, kind of meet that goal to be living life outside of the hospital. Collaboration is definitely, I think, key to all complex care programs, no matter how they're structured. It's not a discipline that kind of functions by itself. We work to communicate, to bring key team members together, and also work outside of the medical center and medical sphere. So an example that I thought of was sometimes children who have a brain condition may not regulate their temperature or their heart rate quite the same as other kids. And that may throw a school system for a loop. So we can provide that kind of collaboration with the school system to help them understand what's normal for your child and when they can be able to stay at school and kind of enjoy those high value days and experiences. Another key feature is that, well, I guess a key feature of our program is that it's supplementary. So we function as a consultant, and that's kind of, I put it in quotes, the consultant model. It's designed to partner with primary care offices, but in our setting, we are not the medical home ourselves. I think that there are pros and cons to this, but it does help in our setting to extend our resources to be able to serve more families and be able to serve families from a greater diversity of locations. And so that's how we are structured. Gabi, you can go ahead and advance next. Some of our families have summed it up, and I've paraphrased this a little bit, but we have been called the Get Stuff Done team. It's a lot of different things to meet needs and focus and serve the children and their families. So we can go to the next slide. About our team. So this is current as of today. We do have a wonderful family clinical advisory group that helps us broadly with our program and our kind of direction. And then we have physicians, nurse practitioners, 4 nurses, dietitian, scheduler, a pharmacist, social worker, and inpatient case manager. It's definitely a team-based approach. All right. Next slide. If you are in the Nashville area or kind of the surrounding area and you have a particular interest in the complex care program at Vanderbilt, I included these enrollment criteria. If you happen to be watching this on a recording, I encourage you to check the website for the latest information because this is something that our goal is always to kind of be able to expand our service. But as of right now, our patients are kind of reviewed by referral for a lifelong chronic illness, evidence of some hospital admissions, 4 specialty groups with significant involvement in the care, and then no other team that's dedicated particularly to the care of your child's illness. So some examples are like the cystic fibrosis program or the sickle cell disease program. And then for intake for a new patient age under 15 years old. All right. Oh, and then our program telephone is there. I hope I saved a little bit of time for questions.
Absolutely. We've still got time. Thank you guys so much. That was wonderful, Christine and Katie. It's really fantastic. And others can join us back on video now. I know that Abby had to leave. Unfortunately, she had something that she had to take care of, but we've still got a chunk of the team here to answer questions and chat for a few minutes. I think it's really interesting to see these distinct kinds of programs where it's very much a medical home, as it is at Cincinnati Children's, and then kind of this consultative model. Are there other kinds of complex care programs that you guys are aware of that people should know about? Other models?
I think that these are the biggest 2 models.
Okay.
There are some that are more episode, they call them episode of care based, or sort of helping specifically in a transition from hospital to home, but not in like long-term continuity. I think, in general, these programs have kind of come up locally, and so they all build on the local care structure and what was already there where, people felt that the needs are. I'll let the other panelists kind of speak to it too.
They are very much just organic to wherever they started. And you can tell like the ones out west are entirely, consultative. They're they're getting patients from, 5 states away because the number of tertiary care centers and complex care centers are scarce in some of those states. And so some of them are a little bit like ours, like they will have a primary care model for those who are close enough, but then they have very well-established co-management programs at a distance.
Mhm.
And some are entirely hospital medicine based and staffed entirely by HM providers who identify these patients in-house and assist with that transition, exactly like Katie said.
Yeah. Okay. No, that's helpful to know. I think one of the biggest challenges probably for families who might be listening is, okay, how do I find one of these, right? Where do, I want that. And Abby touched on that briefly, that, we've got a list of current programs that we know of that we will put up on our website with the webinar itself so that you can reference that. But another thing is families never even getting referred to these kinds of programs. It happened to me, with my son, that, we were inpatient over and over and over again. And it just so happened that somebody asked us that one day, have you ever heard of the complex care team? I was like, no, and we need that. And it changed our lives, but one is, how do you recommend that families go about trying to, advocate for, inclusion in this kind of a program? And some of them that are capped, I mean, a lot of people talked about having caps on them. How do you advocate for, more services for families that really need them? And that's for anybody here.
So most of these families are connected with other specialists, like a lot of specialists. And not to pat myself on the back, but ask for a social worker. Your social workers are going to know your resources. If you are with any specialist that you're a part of, ask them if there is a social worker that you can talk to, that you can bounce things off. I mean, they're the ones who are going to know the resources. And I wish I had done that a lot earlier because I was the same way. I didn't know what I was missing. Not one time after hospitalizations or anything did anybody refer us to or to even tell us about complex care.
Mm-hmm.
So
anyone else want to take that or add to it? I mean, I think that's a great recommendation. Ask a social worker, or even ask, a staff, in an office where you're seeing one of these subspecialists, or right. Just
it's certainly a barrier to our institution. The institution puts out, notifications about, oh, complex care, this is what they're doing, this is who they're seeing, but it pretty much has to be the front of anybody's mind. We as of yet don't have a nice electronic mechanism to flag people who meet certain criteria and directly refer them to complex care. Maybe someday, but we don't currently.
Mm-hmm. And I know we're over time, so I'm going to do one more question unless any others come in. But, somebody asked about, the kind of referrals and counseling that you guys do in these kind of programs. This person, who's part of an advocacy group, has tried to spread the word about the importance of brain tissue donation. It's something that I'm working with my advocacy group on as well, and it's a very sensitive topic. Are those the kinds of things that you broach with families, talking about how they can contribute to research, whether it's brain tissue donation, clinical trials, those kinds of opportunities?
I think that, I would love to learn more about that. I think that we try to connect families with a very wide variety of resources that we're aware of. So I know Amy had mentioned about adapted sports and, activities that engage families and communities. We love to kind of spread news about that and participate when we're aware. I think, our best as providers, our best information often comes from families. And that's sort of that two-way street of education that we get. And we love to share those kind of pieces of information back with families. That's often where I find out a lot of information about.
Mm-hmm. Terrific. Any final thoughts anyone wants to share about complex care programs? I mean, I think, you know, Amelia and Christine, you guys did a beautiful job of sharing how it's a critical piece of improving quality of life for families and those who are requiring this, you know, more intensive medical care. So I really appreciate both of you sharing that. And it was wonderful to get a view, an inside view into the different kinds of programs and how they work. And I hope that any families that are listening feel empowered to ask about this if you haven't had access. And if you don't see it at your hospital, you know, maybe advocating within that they start one. The more they hear it, the more they'll really actually consider, right? And they listen to, when I had meetings with hospital administrators, they say, we listen to families more than we listen to our doctors. So it has to come from, yeah, exactly, Scott. So it's got to come from the families requesting this kind of a service. And then, you know, maybe asking for referrals to, you know, other ones. Cause I mean, Scott, it was interesting to hear, you see people from 4 states. So it's just not something that's available everywhere, but that doesn't mean you still can't access it. So with that, I want to thank everybody for their time today. This was really a fantastic discussion and I learned a lot along the way. Thank you everybody who joined us live. And if you're watching the recording, please check out the website that will have more resources on how to find complex care programs, what they entail, and reach out if you have any questions. Thank you, everyone. Take care.
Thank you.